certainly with the regulatory pathway, to me, that's where it diverges. Beyond that, I don't see it as really being divergent. If you think about biosimilars, if they are approved as a biosimilar, that means they are significantly similar. Essentially, it's not identical, but because it's a biologic, but it needs to be substantially similar and no clinical difference. So, in a sense, in spite of the regulatory process, there's no evidence of any clinically meaningful difference. So in that sense, the divergence really is post-regulatory, in my opinion, where, again, it's a matter of education among prescribers, patients, payers, but then that's, in the United States, that's not really the hurdle for utilization. And so I don't know that this necessarily diverges from the generics scenario, other than it is certainly a scenario that we did not fully appreciate would come to pass, in that the reason for slow uptake in the United States is not necessarily, or at least not wholly, because of concerns about safety and effectiveness. It's more tactical on the part of pharmaceutical companies, and these are business decisions. This is a business, and that's perfectly fine. But the effect is having creating a marketplace where, even though we now have 11 approved products in the United States, only 3 are currently on the market. So that's a place where it diverges from generics in a way, although we did see similar problems with generics, slow uptake of generics back in the day because of the uncertainty.